Surgically treated patients. Adolescent idiopathic scoliosis, 5-year to 20-year evidence-based surgical results by Westrick and Ward, 2011. The 2011 scientific review, Adolescent Idiopathic Scoliosis, 5-year to 20-year evidence-based surgical results by Westrick and Ward, set out to answer an important question that has been on the minds of doctors, patients, and families for decades. What really happens to teenagers who have surgery for scoliosis many years later? The focus was on a specific type of scoliosis called adolescent idiopathic scoliosis, AIS. This is the most common type of scoliosis, appearing in otherwise healthy children between the ages of 10 and 18. The word idiopathic means that the cause is unknown. In AIS, the spine curves sideways in a way that can also cause the vertebrae to twist. For some patients, the curve stays small and does not cause major problems. For others, the curve grows larger, which can lead to changes in appearance, possible back pain, and, when severe, concerns about lung or heart function. Traditionally, if a spinal curve passes a certain size, often around 45 to 50 degrees, many doctors recommend spinal fusion surgery. In this procedure, the surgeon uses metal rods, screws, and hooks to straighten the spine as much as possible and then fuses the vertebrae together so they heal into a solid block of bone. The goal is to stop the curve from getting worse and improve the spine's alignment. However, surgery is a major decision. Families often face pressure to decide quickly, especially if their child is still growing and the curve seems to be progressing. This makes it essential to know what the long-term results really look like, not just a year or two after the operation, but decades later. Purpose of the review. Westrick and Ward wanted to evaluate the long-term evidence for AIS surgery, looking specifically at results between 5 and 20 years after the operation. They wanted to answer two key questions. Does scoliosis surgery lead to better long-term results compared to no treatment at all? In other words, if we followed a group of surgical patients and a similar group who didn't have surgery, would the surgical group be healthier, more functional, and happier in the long run? What are the long-term risks of surgery? This included not only complications during or right after surgery, but also problems that might develop years later, such as hardware failure or the need for more operations. To find these answers, they looked for high-quality studies that followed patients over many years. What the researchers did. The authors reviewed a collection of published medical studies. To be included, each study had to follow patients for at least 5 years after surgery and report measurable outcomes. The review included studies that tracked patients all the way to 20 years post-surgery. In total, the review analyzed 39 different groups of patients who had undergone spinal fusion for AIS. This represents thousands of individual patients across different hospitals, surgical teams, and countries. It's important to note that all of these studies had one major limitation. None of them included a long-term, controlled comparison to people who did not have surgery. A controlled study would mean following two groups, one that had surgery and one that didn't, while making sure they were similar in age, curve size, health, and other factors. Without such a comparison, it's impossible to say for sure whether surgery produces better long-term results than non-surgical care. What the review found. 1. No solid proof that surgery is better than monitoring. The most striking conclusion was that there is no strong evidence proving that spinal fusion for AIS produces better long-term results than simply watching the curve without surgery. Many of the reviewed studies showed that surgery can correct the curve in the short term, often improving spinal alignment by 40 to 60%. These improvements are visible on X-rays and can also change how the back looks. However, the review found no proof that these short-term changes translate into better health, less pain, or improved function decades later. 2. Surgery comes with risks. The review also noted that surgery has risks, some occurring early, others showing up years later. Short-term complications can include infection, blood loss, and nerve injury. Long-term risks include problems with the metal hardware, such as rods breaking or screws loosening, pain at the site of the surgery, or adjacent segment disease, where the spinal levels above or below the fusion wear out faster because they take on extra stress. Some patients in the reviewed studies needed additional surgeries years after their first one. These revision surgeries can be as challenging or even more difficult than the original operation. 3. Short-term benefits are well known, but long-term benefits remain unclear. The review confirmed what many spine surgeons already know. Surgery is effective at reducing the size of the spinal curve in the short term and improving cosmetic appearance. However, the long-term impact on quality of life, physical function, and pain is much less certain. Putting it into everyday language. Imagine two teenagers, both with spinal curves around 50 degrees. One has surgery, the other doesn't. We check in on them 10 or 15 years later. Does the surgical patient have less pain, better posture, or a more active lifestyle? Or do they have similar results to the non-surgical patient, just with a straighter spine on x-rays? This review shows that we don't have enough high-quality, long-term studies to answer those questions confidently. While surgery might improve the appearance of the spine in the short run, there is no clear proof it leads to better health or happiness in the long run, and it does carry potential risks. Why this matters for families and doctors. The findings of this review are important for several reasons. 1. Informed decision-making. Families often face a lot of pressure when deciding whether a teenager should have scoliosis surgery. Knowing that the long-term benefits are not clearly proven helps them have a more honest conversation with their doctors about the pros and cons. 2. The importance of long-term research. Most scoliosis research focuses on results 1 to 2 years after surgery. That's not enough time to see whether the benefits last or whether new problems develop. This review highlights the need for studies that track patients over decades, ideally comparing them to people who did not have surgery. 3. Understanding risks. Surgery is not without its challenges. Hardware issues, infections, and additional surgeries are possibilities, even many years later. Understanding these risks is key to setting realistic expectations. The bigger picture, short-term versus long-term thinking. The review makes an important distinction between what surgery can do right away versus what it can do over a lifetime. Short-term benefits: corrects spinal curve, improves appearance of the back, may help with balance and posture. Unknown long-term benefits: whether pain is less than in non-surgical patients, whether overall physical function is better, whether quality of life is improved decades later. Without high-quality long-term data, the true impact of surgery remains uncertain. What this means going forward. For now, scoliosis surgery remains an option, especially for large curves that are likely to keep progressing. But families should understand that surgery can straighten the spine in the short term. It may not guarantee better health or less pain decades later. It carries risks, both soon after surgery and years down the road. More research is needed to truly compare surgery with non-surgical care in the long run. This knowledge should encourage doctors, patients, and families to weigh their choices carefully, considering the specific details of the patient's curve, health, and goals. Final takeaway. The 2011 review by Westrick and Ward examined 39 patient groups and found that while surgery for adolescent idiopathic scoliosis can successfully correct spinal curves in the short term, there is no solid evidence that it leads to better long-term results than simply monitoring the condition without surgery. The procedure comes with risks, some immediate, some appearing years later, and the long-term benefits remain unclear. For patients and families, this means the decision to have surgery should be made with full knowledge of both its potential advantages and its uncertainties. For the medical community, it underscores the urgent need for well-designed, long-term studies comparing surgical and non-surgical outcomes. Until that evidence is available, surgery should be viewed as one of several options, not as an automatic next step when treating adolescent idiopathic scoliosis.